It is an honor for me to serve as the moderator for this panel, and I want to thank those in charge of this event for giving me this opportunity and inviting us to come and participate. But today we really want to talk about a common goal that I think we all would agree, and that goal is to promote the importance of substance abuse prevention, treatment, and recovery, especially for young Americans. And that's really what this is all about, and we're excited to be a part of that. At CADCA, we work holistically and strategically to prevent and reduce substance abuse, but we do it through building multi-sector coalitions that provide the local leadership by bringing all of the sectors together to advance what we would call a comprehensive evidence-based strategy to address substance abuse at the local level. We think that is critical. We work with more than 5,000 of these community groups across the country. Young people are involved in all of them. And the community model has proven, as you heard from Deputy Director Leary earlier, to, in fact, have evidence-based evaluations that say that the reductions have happened and they continue to happen in a significant way. Not only are we able to reduce substance abuse rates, but we're also changing attitudes and norms using our environmental approach to change the whole population, and you will hear more about that this morning. So I am here to tell you that prevention works. You heard the congressman from Ohio say the importance of prevention. We know that as we look at monitoring of the future, particularly the results of the 2014 one, it tells us that both alcohol and cigarette use among 12th graders in 2014 are at their lowest levels since the beginning of that survey, which was 1975. So prevention, in fact, is working. And in 2014, more youth abstained from using any substance than any other year since 1991. Now, with that said, there's still much work to be done. But the truth is that effective substance abuse prevention can yield major economic dividends, and research shows that when you invest in prevention, you can save anywhere from $10 to $20 for every dollar that you invest in substance abuse. But despite this, for too long, prevention in our country has been underfunded and underutilized, and we are so pleased to see many members of the Senate and the House being interested in reversing that trend. And that's why we support the Comprehensive Addiction and Recovery Act, which will significantly expand prevention and the education efforts that are so necessarily needed to promote prevention as well as treatment and recovery, because we care about the whole continuum. So what I want to do now is introduce the panel that members. What I'm going to do to save some time is I will introduce each one of them so that they can then come and present to you. But our first panelist is Dr. Mark Wilson, who is a professor at Wake Forest School of Medicine, and he has over 25 years of experience in conducting research on substance abuse among youth and young adults, with a particular interest in the role of the community. Based evidence environmental strategies, he is a wonderful executive and a great leader, and you will hear from him. He'll talk about his work in the great state of North Carolina. Our second panelist is going to be a coalition leader, and that's Ms. Haskins, Amy Haskins. Has worked in various areas of community health programming in Northern Virginia and West Virginia for the past 15 years. She began working for Jackson County Health Department in West Virginia, and in 2007, as a public health educator, she's also a sanitarian and the director of the Jackson County Anti-Drug Coalition, which is one of those drug-free community coalitions you heard about earlier this morning. Our third panelist is Dijon Taylor. Dijon is a teen ambassador with the Chesterfield Substance Abuse Free Environmental, known as SAFE Coalition in Richmond, Virginia. Dijon has contributed to many of the substance abuse prevention initiatives taken on by SAFE, including prescription drug abuse among young people. Dijon has also collaborated with various sectors of the community to identify different ways to reduce underage drinking and tobacco use. And our final panelist is going to be Sabrina Lee Sanchez. Ms. Sanchez is the Assistant Director of the Community Outreach Programs at the Partnership for Drug-Free Kids, where she is the program lead for the Above the Influence. Above the Influence, and we call it ATI, is a national program that challenges youth to think critically about the adverse effects of drugs and alcohol use and the potential negative influences surrounding them in their social and media environment. So, I know time is critical this morning, so Dr. Winston, would you please, all the panel members, please come up and take your seats, and we're going to get started. Okay? And you're going to do it from here? Yes. Okay. Please.